on, everybody, say you're all I need. You're all I need. Every breath you breathe through me. You're all I need. You're all I need. Let your rivers flow through me. Let your rivers flow through me. Say it again, you're all I need. You're all I need. Every breath you breathe through me. You're all I need. All I need. Let your rivers flow. All I need. All I need. You're all I need. You're all I need. All I need. Come on, lift it again. You're all I need. Every breath you breathe through me. You're all I need. All I need. Let your rivers flow through me. All I need. All I need. Every breath you breathe through me. All I need. You're all I need. Let your rivers flow. Say you're all I need. 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 He said it's I. He said it's I. Being lifted. Out your own. You are. You're my closest friend. In you I live. When I need. I wanna draw closer. Need to draw closer. Be lifted. I'll draw. You're my closest friend. In you I live. When I need. I wanna draw closer. Need to draw closer. I wanna draw closer to you. You're all I need. Every breath you breathe. You're all I need. Let your rivers flow. You're all I need. You're all I need. Every breath you breathe through me. You're all I need. Let your rivers flow. You're all I need. All I need. All I need. All I need. You are. You're all I need. Say oh. Say
Facts, faith, and fear. Let's talk about it. I am Sharon Williams, president of Alpha Kappa Alpha Sorority Incorporated, Chi Omega chapter. My chapter is located here in Rocky Mount, North Carolina. We're excited to serve as the host chapter for this webinar in partnership with over 11,000 active members of the Mid-Atlantic region, under the esteemed leadership of Ms. Jennifer King Congerton, Mid-Atlantic Regional Director. We are committed to doing a new thing while providing service to all mankind. At this time, I would like to introduce Ms. Sherry Bryant, member of Chi Omega chapter and chapter coordinator for program Target 2 Women's Health Care and Wellness, who will introduce our guest panelists and serve as our moderator during this webinar.
Thank you, President Williams. The COVID-19 pandemic has affected us in many ways. Alpha Kappa Alpha Sorority Incorporated continues to raise awareness of critical health issues impacting our communities. We are starting to see a little glimmer of light, but we must continue to do our part. I am honored and excited to introduce our guest panelists who have provided and continues to provide strong support for our communities in the midst of this unprecedented COVID-19 pandemic. With diverse backgrounds of expertise, our panelists will share a rich set of perspectives on the heartaches and hardships associated with the COVID-19 pandemic, the COVID vaccine hesitancy, facts, faith, and fear, and what lies ahead. Introducing our first panelist, Dr. Tedra Anderson Brown. Dr. Tedra Anderson Brown is the Behavioral Health Medical Director for Blue Cross and Blue Shield of North Carolina. She joined Blue Cross Blue Shield North Carolina in November 2019 as a recovery ally. Dr. Anderson Brown is the family member and friend of those living with mental health and substance abuse challenges. Dr. Anderson Brown is a proud alum of Duke University, where she earned her undergraduate BS in zoology in 1987 and medical degrees in 1991, and completed her residency training in general psychiatry and then a fellowship in the addiction psychiatry. She is board certified in both. Dr. AB, as she is affectionately called, is a professional involved in medical and community-focused organizations. Dr. AB is also a proud and active life member of Alpha Kappa Alpha Sorority Incorporated and has achieved Silver Star status awarded to those with over 25 years of membership, and she is currently an active member of Alpha Zeta Omega chapter and serves as the chairman of the Mid-Atlantic Region's Medical Board. Dr. Eric Bonner. Dr. Eric Bonner is an internal medicine physician at Vidant Internal Medicine in Edenton, North Carolina. He also works at the Vidant Chowan Hospital as a hospitalist and at the Brody School of Medicine as an assistant professor of internal medicine. He continues to serve as the medical director for ambulatory quality and patient safety, the regional medical director for the Vidant practices in Bertie, Chowan, and for Clemens counties, and director of continuing medical education for Vidant Chowan hospitals. In his practice, he continues to teach students and residents from North Carolina medical, nursing, and physician assistant schools. Born in Edenton, North Carolina, Dr. Bonner graduated from John A. Holmes High School and attended Livingstone College as a presidential scholar. Dr. Bonner graduated summa cum laude with a Bachelor of Science degree in biology, and after completion of his undergraduate studies, went on to Meharry Medical College in Nashville, Tennessee. Pastor James D. Gailliard. He is has dedicated his past 20 years to human, economic, and community development in North America and South Africa. Since 2005, he has pastored Word Tabernacle Church in Rocky Mount, North Carolina. This church has grown from 14 members to a mega church serving thousands of families in North Carolina and Virginia. The church is housed in a 110,000 square foot former Home Depot, now called the Impact Center, providing a place for programs, partnership, and paradigms that enables people to progress. Pastor Gailliard is also, since 2019, an elected and representative for House District 25, which covers the Nash County and Rocky Mount area in the North Carolina General Assembly, the first African American to hold his seat. His work has been featured in many publications, such as Facts and Trends, Church Executive, Business North Carolina, and many national and local newspapers. Lastly, but certainly not least, Dr. Christina R. Payton. Dr. Christina R. Payton is a board-certified OBGYN, graduated from Roanoke College in 1997 with a BS in chemistry, graduated from Case Western Reserve University of Medicine in 2001, completed her residency in 2005 from Drexel University in Philadelphia, and is employed with Nash OBGYN since November 2008. Dr. Payton is also a proud member of Alpha Kappa Alpha Sorority Incorporated in the Chi Omega chapter. Before we get started, I'd like to remind everyone that, as you saw in the chat, that this webinar is being recorded so that we can publish for those who are unable to join today. So please place your questions in the chat, and we will attempt to address them throughout the panel discussion if time allows, and at the conclusion of the full panel discussion. So let's get started. I'd like to begin with you, Pastor Gailliard. As you have been leading us in both of your capacities as a pastor and a House representative, share with us some of the COVID stats for North Carolina, and based on those stats, some of your thoughts about vaccine hesitancy.
Sure. Well, thank you very much, Sherry, for the invitation. Thanks, Chi Omega, and for all the AKAs and for the physicians that are with us today. So some quick updated stats. We're at about 956,000 confirmed cases in North Carolina. We are at about 12,500 confirmed deaths here in North Carolina. And in terms of the vaccination side, we're almost at 50% of the adult population with at least one dose, right at 47.7, I believe the number was as of yesterday, and about 37% of the adult population having received both vaccines. That's statewide. And just to bring that data to a more local level, and I always look at data from the perspective of our AHEC, our Area Health Education Center, and in our community, it's Area AHEC, which is Nash, Edgecombe, Wilson, Halifax, and Northampton counties. So when we look at that data, what we start to see is we're not doing as well as the state is doing, and I think that's where our opportunities present themselves. And so, for example, in Nash County, we're at about a 30% first vaccination rate compared to, again, about 47% statewide. And so there's a lot of improvement there. And so when we begin looking at our community, I think those are some real opportunities. And then when you look at the African-American community, really specific to our population, we're looking at about a 17% African-American vaccination rate in our community. And right now, African-Americans are about 23% of the population in the state. And so there's some real opportunities there relative to our population to get vaccinated.
Thank you so much, Pastor Gailliard, for those stats. So now let's move to Dr. Bonner. With the stats that Pastor Gailliard just shared with everyone, let's please jump right in and let's start talking about some of the facts of the vaccine.
So thank you, Sherry. First, I want to thank everybody for just being a part of this, and for Chi Omega for having me. So thankful for the opportunity to speak to everybody. But as far as the statistics that Pastor shared, he hit the nail on the head. We have done a pretty good job in North Carolina with rollout, and a decent job across the East at making sure that the vaccine is available. But some of our communities just haven't done as well as others at being willing to go get it. Right now, we do have 3 vaccines on the market. Pfizer was first in December, Moderna in January, and then Johnson & Johnson a little later. Even with the pause as of yesterday, Johnson & Johnson is back on the market and is available. As far as the difference in those vaccines, Pfizer and Moderna are very similar. They're both what we will call mRNA vaccines. They work by allowing the cell to do what it's already doing anyway. Our cells have mRNA, which is really just a blueprint to show them how to make different proteins. All of the proteins in your body are made based on mRNA coding for them. And so what the Pfizer and Moderna vaccines do is they just give you a different blueprint to make a different type of protein. And that protein is a spike protein that is on the outside of the coronavirus. When you are able to make that protein because of the mRNA, then your immune system gets a chance to see it and figure out how to make antibodies against it. So that way, if you ever see the spike protein again, like if you were to get coronavirus, your body kind of has a head start. You'll already have some antibodies to jump on it from day one, rather than your body having to learn how to respond and figure out what part of that virus it can attack. So that's how they work. They only have 4 ingredients. They have the mRNA, fat, salt, and sugar. That's it. There's no egg, there's no mercury, there's no nanoparticles, there's nothing else in there. And so those vaccines are as clean as far as their ingredients as any vaccine we've ever had. And they're also more effective than pretty much any vaccine we've ever had. Both of them in their studies worked on about 95% of the people in the studies. And the impressive thing is they were even better in the Black community as far as the participants in the studies. When I first heard about the Pfizer and Moderna vaccines, the first thing that I wanted to look at was, were we represented in those trials? And I was pleasantly surprised to know that it was a pretty representative sample. We were about 10%. And as far as the adult population in America, we're about 10%. And so it was a good opportunity to see how we would do as far as side effects and those kind of things. And what we saw was there wasn't any increased risk. And we actually fared better, specifically in the Pfizer trial. No African-American people in that trial developed COVID during the period that they were being monitored. And so that was impressive to me. As far as Johnson & Johnson, that vaccine is a little different. It is more based around the Ebola vaccine and how that one came about. It uses a adenovirus, which is a killed virus, as the way to get the material into the cell. And so rather than using the mRNA to teach your cell how to make the antibodies, what the Johnson & Johnson vaccine does is it puts the genetic material in that virus that is not able to replicate itself. And when a virus doesn't have the ability to replicate, it cannot make you sick. But once it gets in, then it teaches your body to make the same antibody to spike protein. And so the end result of all 3 vaccines is exactly the same. You make antibodies to spike protein, but Johnson & Johnson is able to get your cells and your body to do it in a slightly different way. To be completely honest with you, one is not any better than any of the other ones. They all work really well, actually, and they all are safe. As far as the Johnson & Johnson pause, that happened because 6 ladies developed blood clots out of the 6.8 million people who had gotten it at that point. To put that in perspective, that is a little lower than the chances of being hit by a falling satellite. And so the risk was very minimal. The only reason that it was taken off the market is because we have other options. If Johnson & Johnson was the only vaccine available, benefits clearly outweigh risk. There never would have been a pause. But it was an opportunity for doctors to catch up and to understand, well, when we do see this, how do we treat it? And that was the real reason for the pause, was to make sure that we communicated to our hospitals and our physicians on what to do if they ever see that kind of complication. And so that pretty much explains all 3. And feel free to put questions in the chat as they come up.
Thank you, Bonner. Another thing that we hear a lot of sometimes when talking about vaccine and making that choice, some say, "Oh, the vaccine was just created way too fast for me." What would you comment on that?
So yeah, it's a very, very valid question. But I think it speaks to the fact that sometimes we can feel like things didn't exist because we didn't know about them. And so COVID-19 is caused by the virus SARS-CoV-2. SARS-CoV-1 was back in 2002. If anybody remembers the SARS epidemic of that time, that virus didn't really make it to the US. There are a lot of reasons for that. Some of it was leadership and the federal government at the time. Some of it was we were just coming through September 11th, so there wasn't as much international travel. But a lot of different reasons why that one didn't spread as rapidly as this did. But because of that, there were countries and companies that started working on a vaccine. There was not a global push because there were countries that weren't as affected and didn't commit the resources to that. And so when this pandemic happened, there were 18 years of research that had already been going on about coronavirus. And we had the whole world working towards a common goal, which hadn't really happened before. But the main reason that this happened quickly was three things. One, whenever there's clinical research going on, you have to have a certain amount of participants for your study to have the power that you need for your results to be relevant. Pfizer and Moderna both had about 40,000 participants, and Johnson & Johnson had about 35,000. Normally, to get that many participants, it takes years. Those companies were able to do it in a matter of weeks because of the pandemic. People were jumping to get a free vaccine because we didn't know that eventually it'd be free for everybody. And so a lot of people wanted that opportunity to get vaccinated and start getting back to normal. That cut years off the study right there. The second thing is funding. Normally, you have to get institutional review board funding. You have to get, NIH to give you grants or something to get the billions of dollars it takes to do a study of that magnitude. Pfizer funded their own. They said, we'll take $2 billion of our own dollars. We'll put it towards making our vaccine. And that was the way that they were able to get started quickly and not have to worry about that kind of thing. Moderna did get some government funding and had some backing from the federal government. And the interesting thing is, even though Pfizer did it on their own and didn't have any extra help, they were the first ones to market. So for anyone who's worried about the political influence of those kind of things, Pfizer cleared that up for all of us and said, we won't even worry about the government. The other thing is, because of Operation Warp Speed, two things were able to happen. They were able to do their phase 1 and phase 2 trials concurrently. So they didn't have to finish phase 1 and then go to phase 2 and then phase 3. Now, all of those phases were the normal amount of time and the normal amount of participants that they would have been. So no steps were skipped. They were just able to do some of those steps at the same time. And that helped as well. And then the third thing was also because of Operation Warp Speed. Once they got part of the way through phase 3 and realized that more than likely this vaccine was going to make it to market, they were able to go ahead and start production. So when it was approved, we weren't waiting 3 or 4 months for those supply chains to catch up and to get us vaccine. And all of that sped up this process. And to be honest, none of that had anything to do with the actual vaccine itself. It was more about our processes and the things that we have in place to get things out to Americans when they need it.
Thank you so much for that. So now we'll move to Dr. Christina Payton. So Dr. Payton, as a OBGYN, I know that there has been a lot of misinformation out about vaccine safety for women as it relates to fertility, pregnancy, breastfeeding. Please share with us some of your thoughts.
Okay. Hello, everyone. Thank you for giving me this opportunity to speak to everybody and to reach a large platform of people. I'm not saying that I'm a COVID expert on either the vaccine or the virus, but I am someone who's lived with COVID for over a year now and researched it daily, frequently for my patients, shared information with my partners, someone who's taking care of people with COVID. And I can tell you, I was really excited about the vaccine, but also skeptical like a lot of people over how fast it came. But I also did my research too and was very reassured about it before it came on market. As a healthcare provider, I can't work from home. So I'm exposed to COVID on a fairly frequent basis. And the vaccine gave me a peace of mind because, as some of you know, my mom lives with me. And both of us checked the boxes for people who would not do well if they got COVID. We're over 40, we're African-American, we're both diabetic, we both have asthma. So, and she took the quarantine pretty seriously. So if she got COVID, it was going to be for me. So the vaccine has actually been a great thing for me. And I thought a lot of people would take advantage of it. But as of this morning, Good Morning America said only 35% of people in America are fully vaccinated. In order to reach what's called herd immunity, which is where people who aren't vaccinated are protected by people that are vaccinated, you need to get to about 80%. And so we're not close to that yet. And speaking of our local area, my patients mainly come from Nash, Edgecombe, Halifax. The health departments have reported people aren't coming in as much for vaccine. and they're actually having to waste vaccine because most vaccine, you have to use it within 6 hours, and people just aren't coming in as much as they were in the beginning. So when I'm talking to my pregnant patients about COVID, generally I start with COVID itself and not the vaccine so much. So what we know for sure is that pregnant women who get COVID and get symptomatic tend to do worse than non-pregnant women who are symptomatic. They're more likely to get really sick, they're more likely to end up in the ICU, on the ventilator, and they're more likely to die. And if mom doesn't do well, baby doesn't do well. Also, when you're pregnant, it makes it harder to treat you in terms of ventilation, because one of the things that helps with COVID is turning people on their stomach for a certain amount of time. When you're pregnant, we can't do that. So we can't treat you as effectively as if you were not pregnant. For pregnant women who do make it through COVID, they've been shown that they're more at risk for pregnancy-induced hypertension, growth restriction, and early delivery. Hypertension, as African Americans, we're already more at risk for that, especially in our pregnant patients, and we tend to do worse. Our kids tend to do worse when they're delivered preterm because they have more breathing problems, more problems in school. So we're endangering ourselves by not getting vaccinated. So my moms that have gotten over COVID tend to have shortness of breath for more prolonged periods of time. They have the fatigue that you get with COVID and also with headaches. But I understand why they're hesitant, because nobody wants to do anything that they think is going to hurt their baby. So I always tell them is the vaccines that are around, they're not live vaccines. They're not going to replicate in your body. They're not going to affect your DNA. They don't change anything like that. And they're not going to cross the placenta. Now, what can cross the placenta is the antibodies that you make for the COVID vaccine that's been found in umbilical cord, blood, and also in breast milk. Babies, when they're first born, for the first 6 months, they have small airways, which puts them more at risk for respiratory disease. And they also have underdeveloped immune systems. And we've already started vaccinating pregnant women, Tdap, flu vaccine, to help kind of provide babies with what's called passive immunity till they can make their own antibodies. There are some pregnant women weren't studied in COVID vaccine trials, which makes people really nervous, but pregnant women aren't included in most trials for drugs. There are ongoing studies now from Pfizer that have, and Moderna, both have pregnant women in them that are receiving the vaccine in the second and third trimester. And they're showing that people who get vaccinated by early third trimester pass on good immunity to their baby, as opposed to people who don't get vaccinated or only get one shot or get vaccinated late in pregnancy. Everybody's worried about vaccines and autism. There's no scientific study that's proved that vaccines cause autism. There's also, it's been scientifically proven that the vaccine does not cause infertility. That's the social media rumor that has no basis in scientific fact. I tell my patients who don't want to get vaccinated or can't get vaccinated that they need to consider, one, can they socially isolate? And can everybody in their house? Because I've had several patients who have done good quarantine themselves who've gotten COVID from their partners. The other thing you got to look at is what's the COVID rate in the community? We're not as bad as we were in the height of the pandemic, but we're still not as good as we were in August when people were really quarantined. Also, you got to look if you have factors that are going to make you do worse if you get COVID, like do you have obesity? Do you have hypertension? Do you have diabetes? Because all those things are going to make you do worse if you get COVID. And if you're going to not get the vaccine, you still need to wear your mask, which is harder when you're pregnant because it's harder to breathe when you're pregnant. But you also need to socially distance with all your family and friends and make sure you're washing your hands if you go out.
Thank you so much, Dr. Payton. So now we're going to go to Dr. A.B. So tell us a little bit and share with us about mental illness exasperation and some of the myths about COVID-19 vaccine and any of the stats that you'd like to share about mental health with COVID, et cetera.
Sure. Thank you, Ms. Bryant, and to my sisters of Chi Omega for inviting me. First, let me just say that I'm humbled to be here. I always am when I'm asked to speak. And I know you mentioned it earlier, but I'm a psychiatrist, but I really believe that I have to share that I am the friend and family member of those who have mental health and substance use challenges. So I try to make sure that I let people know that, because I think in our communities of color, we don't always talk about that. And so I also want to thank you all for your thoughtfulness to have mental health issues being brought to the forefront today. So a lot of great information from all of our panelists. I do want to say, if you all are like me, who would have thought, right, 14 months ago that we would still be in this place with COVID? And it really has had, unfortunately, a psychological impact on all of us. I'm the first to admit that I have my days where I just feel like, and so I like to be honest about that, because I think when we begin to openly share how we're doing, we can get the help that we need and learn some strategies to manage it. And so feeling overwhelmed during this time, I do like for people to know it's completely natural, but let's just tune in, lean in to our feelings. Everyone should know that about 1 in 5 persons in this country will experience some sort of mental health challenge throughout their lifetime. And what we're seeing from the data during COVID is that those stats are actually increasing. And depending upon the information you read, 4 in 10 or 40%, or even higher, 50, 60, 70% are feeling stressed out, experiencing anxiety, depression, and just general fatigue. We've also been seeing an increase in substance use and overdoses in our emergency departments during COVID-19, unfortunately. So it's not uncommon. We continue to see, unfortunately, a rise in those numbers. I think it's important for us to understand a little bit about stress. So stress is this state of strain or tension that's caused by, everyday demands or circumstances. And some stress is actually good for us because it keeps us on our toes, like wearing our masks when we're out in public, being prepared for a test, for example. But if that stress level stays high and doesn't come down, then that can lead us to physical ailments as well as emotional difficulties. And so from a physical health perspective, it can lead to high blood pressure, heart disease, stroke, and even lower our immune system, which our ability to fight infections. And of course, then that increases our risk for COVID. But it's also chronic stress can lead to emotional issues like anxiety, depression, or even thoughts about self-harm. And so feeling anxious can have physical manifestations like headaches, grinding your teeth, feeling this tension in your jaw, your neck, your back aches, but it can also just feel like this sense of worry and dread for no apparent reason. Depression can be like the downs, like feeling sad, not just like, something happens, I feel sad for a little bit, but constantly feeling sad or irritable, not being able to sleep or sleeping too much, not being able to eat or eating too much. All of those can be signs and symptoms of depression. I do like to mention suicide because sometimes people get so depressed or distraught that they may feel like harming themselves, and this sense of hopelessness, like things won't get better. And it's important for us to recognize if somebody talks about harming themselves or not wanting to live, that we take that seriously and assume we'll be the only person who can get them help. But the good news with all of that is that help is available, treatment is available, and treatment works. And so we have some really good options. One of those is talking therapy. You might hear the word counseling, which is really more than just venting, but it is a way for us to learn how to manage how we feel. It's a way for us to learn how to cope with some of the things, and not just COVID, but racial tensions and things like that, if we were honest. Medications may be necessary, but that's something you would talk with your provider about. The other thing that's really important is beyond professional help, we should look to our clergy. We should look to trusted friends to talk with, but we also have the ability to do self-care strategies. And I like to mention that because I know self-care is now a buzzword, we hear it, but it's really not just a one and done. Self-care should be something that we practice, that should be intentional, that we think about every day. And self-care is not selfish, that's a myth. Taking care of yourself is so important, vitally important for us. If you think about us as a community, we're all caretakers, right? That's all we do. If you think about it, if I take care of me, then I'm going to be better able to take care of everybody else who needs me. And so practicing those strategies, and they're different for everybody. It could be exercising, which also helps with some of the other conditions that we see are higher and make people more prone to having more severe consequences of COVID. It could be eating right, meditation, prayer. There are any number of activities, painting, listening to music, and sometimes intentionally doing nothing is also very important and a part of our self-care regimen. So I just wanted to make sure that we stay connected and then begin to focus on wellness strategies that are going to help us psychologically as well as physically. And don't forget to put your questions in the chat.
Thank you so much, Dr. AB. And we do have a few questions in the chat, so I will go to the chat now to get some of those questions addressed. And it looks like the New York Times just reported that men are less likely to be vaccinated than women, and that they are not likely to listen to women who encourage them to get vaccinated. What do the statistics look like in the Black community, and do statistics show that Black men will listen to the urgings of Black women? And I saw that Dr. Bonner did reply, but Dr. Bonner, anything that you'd like to also verbally express to that question?
Not really. I tried to hit it out, but yeah, but that those numbers in Pastor responded to, they do pretty well represent the Black community, as well as the brown community, white people. Women tend to be the ones who not only hold down the church, but also hold down healthcare. And so most of what men do is, at the direction of wives and mothers and sisters. And so you all have a very valuable place during this pandemic. But just to reiterate the part in the chat, there was a study in December in Annals of Internal Medicine, which is a journal for most internal medicine physicians, that talked about the power of having a Black physician and how Black men are much more likely to ask questions and to be willing to do it when they have a Black doctor, specifically a Black male doctor, to ask their questions and talk to. And so that's been about the only thing that has shown any real improvement in the rates of men. Not to say that that's the only thing that'll work, just that's the only thing that's been shown. Unfortunately, there isn't a lot of research that goes towards really anything as far as Black males. And so I think as we go forward, hopefully that is something that we'll continue to look at with not just the COVID vaccine, but with medication adherence and so many other things that affect our community.
And may I add just a thought, because I absolutely agree with Dr. Bonner. One of the things that's so important in our communities, and I'm sure in yours as well, but we have Pastor Gailliard on the phone and Dr. Bonner sharing their personal stories, and for the church to be involved. Certainly in my area and in other areas, I think pastors and leaders are talking about this, and really holding like COVID clinics and things like that is so important. In my own experience, my husband, for example, was able to influence his brothers, who initially were like, we're not going to get it. And I have to admit, I was hesitant as well, and talked to a dear friend. And one of the things he and I talked about was our spheres of influence in our community. And he went and talked to his brothers, and now they've been vaccinated. And so this is one of the things, like, if you remember that old commercial, you tell two friends and tell two friends and tell two friends, that's really what we have to do to get this mushroom ballooning, if you will, so that we can, talk to the people in your circle and then have them talk to the people in their circle. And so I'm so glad today that we do have our brothers represented, because I think they do have that ability to make that impact.
Yeah, if I could just jump in too, Sherry, and I have to say, you physicians are pretty darn awesome. You ever had you hear a really good preacher and you're like, man, if I wasn't saved, I would get saved. And so like, I'm listening to all of you talk and I'm like, wow, I would get the vaccine again. Like you have really laid it down. So it's been great information. I just want to point to just two things very quickly to add. I think one, to Dr. Anderson Brown's point, I think we have to do a better job of leveraging our captive audiences. All of us have our sphere of influence, and we need to challenge our African American Divine Nine fraternities to have these conversations, our Masonic orders, our Masonic lodges. But I do think it should not be lost on this conversation that COVID has really exposed the issue of social determinants of health and health inequity. And as Black men, we very much have a culture of, I'm not sick, I'm not going to the doctor. And so for the brothers that's walking around feeling fine, we have to do it. We have to make sure we're having these kinds of conversations with them, and we are modeling it ourselves so that they understand the value of getting immunized. And those of us who have influence and a voice, we have to really press that conversation with them, and almost, I don't mean in a negative way, but almost shame them into doing what's right. You know, we went through this with prostate cancer. You know, hey, on a Sunday morning, if you're over 40 and haven't had your prostate checked, stand up. You know, and then, you know, why don't you love your wife enough? Why don't you love your child enough? And so we really have to have those really tough, I think, kind of conversations to make sure that we're getting our people vaccinated. I think the other thing I want to add really quickly is that I think we have to do a better job in our communication to communicate that it is a free vaccine, because oftentimes it's in the little print, and we forget that in North Carolina, we have 500,000, maybe the number could be as high as 700,000 uninsured people. And so the lack of not just access, but affordability question also can become a hesitant factor.
Absolutely, so good. Couple other questions in the chat, which I believe we covered, and I want to make sure we keep moving, which was about the Johnson & Johnson pause, causing more hesitancy within the communities. We got that one answered. There is another that said, if you have already had COVID, is it necessary to get the vaccine? Would you already have the antibodies? Someone could answer that.
Yeah, I could take that one. So yes, my general advice to my patients is by the 90-day mark, get vaccinated. The vaccine and having COVID create different antibodies. So COVID has a capsule. And when you have COVID, you'll develop antibodies to that capsule. Those antibodies don't last very long. Actually, the less significant your symptoms are, the less time that those antibodies seem to last, based on what we know at this point. But when you get vaccinated, you get spike protein antibodies, which are much better at covering different variants of COVID and lasting a little longer. And so the recommendation is to do it. And it doesn't really matter which one you get, but just about everyone needs to be vaccinated. And if you do have any specific questions about, you know, well, I had this disease or I had this issue when I had COVID, talk to your doctor. But in general, there aren't really any contraindications. Like if you're allergic to a flu shot, allergic to a pneumonia shot, get your COVID vaccine. They don't have anything in common. There really aren't reasons. I think I've had one patient who I've recommended to hold on for a little bit, only because I said, you've probably heard about the 3 on the market. There are 94 different vaccines in trials right now. In another couple of years, we'll have hundreds of COVID vaccines. And so if we ever have a COVID 2025 or another pandemic, we're going to have a completely different vaccine that's going to seem to have popped up really quickly, and people are going to be like, oh, that was fast. And it's like, no, we've been working on it since 2019. And it's just, you know, sometimes we're prisoners of what we don't hear about because we get so much information all the time. But there are a lot of vaccines, there are a lot of options. I do not recommend waiting for one of the other options, though, unless your physician has talked to you about that. And like I said, out of the thousands of patients that I see, there's one person who has a pretty unique case. But like I said, most people don't have a reason to wait.
Thank you.
And again, if I could just add, I think it's also very important to notice that if you've had COVID, as Dr. Bonner mentioned, what we're seeing for those folks who do get the vaccine after the recommended wait period by their doctor, some of the longer term effects or some of the side effects seem to get better once you have the vaccine. So that's really important to note. We're seeing what we call long COVID and symptoms, unfortunately, but we are getting a lot of reports from our primary care doctors and healthcare that those symptoms and through the trackers are getting better after you have a vaccine.
Great. One more question from the chat, and then we're going to move on to our faith portion of it. The question was, I'm 32 weeks pregnant. Do you recommend I get the vaccine now or just wait until after the baby is here? I haven't had COVID, but was fearful of getting the vaccine.
Okay. What I'll say is, one, they've shown you pass on better immunity to the baby if you get it early in third trimester, if you get both your shots. So if you get it at 32 weeks, you'll be doing pretty good by the baby. The second thing I'll say is the CDC has tracked 86, as of mid-April, 86,000 pregnant women who have been vaccinated, and they've shown no increased risk of adverse outcomes, no increased risk of stillbirth, malformation, preterm labor. They look the same as everybody who's not vaccinated and pregnant.
Thank you for that. So moving to the faith portion of our conversation, we'll start again with you, Pastor Gailliard. Talk about how COVID has impacted the church and how we can exercise our faith in getting the vaccine. And anyone else that would like to speak to that perspective, please jump in after him.
Sure, and so thanks for that question. And let me just, and I want to chime in very quickly. And I did a quick calculation because I got some new data today from Department of Health and Human Services around the Johnson & Johnson vaccine. So there were 15 total cases out of 8 million doses which caused the pause. And so to Dr. Bonner's point, I just did the quick math. That means 99.9998% of the people are not impacted in that way. And so the reason I start with that on the faith side is because we have to our faith should inform our decision making and not our fears. And just from a lens of our Christianity and what we believe doctrinally and theologically, quite frankly, whenever we allow fear to dictate our decision making, it is already then a decision that is made in the context of sin. And so faith must form our decision making. The other thing that I would say about this is that our faith should be one of sacrifice and surrender and service. It should not be one of, I'm just thinking about me, right? And so this is a unique opportunity in our faith context to really show love of mankind, love of one another. Obviously, it's impacting how we're accustomed to worshiping, particularly in the African-American context. And I don't know if Tedra will speak to this at all, but I'm concerned as a pastor on the long-term mental health implications of the numbers of graveside funerals we've had to do and us not having the ability to funeralize like we normally do. I'm a huge advocate for obvious reasons of the Black church, and I think we do a lot of things well, but one thing we surely know how to do is send you home right. But yet in this context, we've had to stand around gravesides. We've had to limit the number of people that can be in a space, and we've had to really change and alter and adapt our grieving process. And there's probably going to be some long-term implications of that, right? So that concerns me from a perspective of a pastor. However, everything that is essential to what we believe, we have been able to hold on to. We've had to do it a different way. We've not been able to touch and hug and embrace, but yet we've still been able to live out our faith. And I would argue in some ways, we've been able to live it out more fully. We've been able to increase our outreach efforts. We've been able to expand our voice and influence. We've been able to become more active in terms of how we engage and how we protect and how we serve and how we care for one another. So this is probably the time, and I may be a little bit different, but I don't think I am. This is probably the time in our faith walk where we who have professed Christ, we who hold on to whatever our faith traditions are, where we have to now embrace the reality that this moment, this season, I don't get to do it my way. I don't get to have it the way I want it. And the worst is behind us. We've got a couple more months and I think we're going to be in pretty good shape. But again, I think that this is not the time for us to make decisions in fear. We should make decisions in faith and let that govern our practices right now.
Thank you so much. Anyone else, anything to add on that before we move to checking the questions here in the chat?
So while you're checking, I'll jump in and just say, amen, Pastor. I really think it's important for us to rely on our faith, as I mentioned earlier, to pray. But I think that prayer for me, and I'm a licensed minister, by the way, should lead us to action. our prayer life should then have some feet on it, and those feet are making decisions, as was mentioned, that are for you and your family. And while it's a personal decision, it should lead you to do things that are in accordance, as already said. And I would also say that my belief is that science points to God. God has allowed us to be able to have these opportunities through vaccines and other measures to keep us safe, to keep our loved ones safe. And so I just wanted to say absolutely that we should follow through with that.
Thank you so much. So looking at the questions here, we do have one question that's asking about, can someone speak to COVID-19 vaccine as it relates to children birth to 17? And any stats on COVID deaths in Nash County and other counties surrounding our local area. And I will just mention on that last part of the question, Pastor Gailliard did put a link in the chat that you could actually go to the dashboard and see some of that data just to keep things moving. But if someone would like to answer the question about the vaccine birth to 17.
So it's right now still being studied from 6 months to 12. The 12, so Pfizer is already approved for 16 and up. So we're really looking at more birth to 16. And so the 12 to 16 data has already come out and has been extremely promising. And so Pfizer will more than likely be approved for 12 to 16 in the relatively near future. As far as the 6 month to 12-year-old group, I think the delay in that has proven a little bit of what I was talking about earlier about how quickly adults signed up for these trials and why it happened so quickly. People jumped in to be a part of these trials, but people aren't jumping in to throw their kids in them. And so that has really slowed things down and made it take a little longer. And the second part of that is children have never been affected by COVID as severely and as often as adults have. And so when you're trying to design a study, Pfizer and Moderna's and Johnson & Johnson studies were looking at, you know, what percentage will these vaccines cut down deaths, cut down severe disease, cut down hospitalizations, that kind of thing. Kids aren't dying or having severe disease or having hospitalizations at a very high percentage. So you have to design that study completely differently. And trying to figure that out and how to say that this vaccine is effective when kids are affected at such a low rate anyway, is the important thing. Because what we really want to know is how are we going to protect these kids as they get older and they do get to high school and college and they are more likely to get sick or have issues. And as we see new variants and younger people starting to get sicker, how do we make sure that they're protected at that time too? And so that's been a little bit of the holdup. But I do think sometime, just guessing as far as timing, but sometime in the next year, we'll have a lot more data and hopefully approval for that age group.
Thank you. Another question is, are these vaccines FDA approved? If not, why, and what is the relevance? Meaning, why is it important or not to have FDA approval?
So anybody else on the panel, please cut me off if y'all want to talk about anything. But so the vaccines right now all have an emergency use authorization. They do not have FDA approval yet. For most who don't follow that kind of thing, I want to make sure everybody understands that it's always the process. FDA approval takes time. It takes, you know, post trial analysis. It takes real world data. I think the Johnson & Johnson vaccine proves that, because if you have 35,000 people in a trial, you may not see a once in a million complication because you didn't have 1 million people in the trial. And so historically, when a vaccine came out, anybody who's been in the military will tell you they got it first. And so we got a lot of data from our military before it got to the general public. With this one, everybody got it at the same time. And so even though we know that we aren't really concerned about a lot of long-term issues, there are always the times where you may see a 1 in a million or 1 1 in 5 or 10 million kind of thing that you just didn't see before. None of that will be common enough to necessarily take something off the market or change the way you do things. But because of that, that time is what you are waiting for to say, okay, we'll go from our EUA to our approval. And so that'll happen eventually. There's nothing that will keep them from being approved. It's just a time game.
Thank you so much. We do have some more questions in the chat, and we're going to get back to them. But I do want us to move to the fear portion of our panel discussion and really talk about that. And I think that that will also help with some of the questions that's left in the chat. And so, Dr. Bonner, I'll start with you to kind of talk about the fear that we have heard. I know we've heard people reference the past with the Tuskegee experiment, people who have fears because they don't like shots and needles. Talk about that a little bit for us.
Sure. So as far as fears, there are a lot of them. I think that COVID vaccines have come along at a time where fears are a little more prevalent because of social media and 24/7 news networks and a lot of information. Anyone on here that's old enough to have gotten their polio vaccine back in the day knows that when the government or anybody said, hey, take your kids to get a polio vaccine, nobody asked y'all how y'all felt about it. Everybody got their vaccine and kind of kept it moving. And because of that, we don't have polio anymore. And so as we've gotten to a time of increased information, I think sometimes we also have accompanied that with a time of less actual context for that information and knowledge of how that information fits together. And so this pandemic was predictable. Somebody asked to say their concern in the chat earlier about Bill Gates and some of that stuff. Any of my patients will tell you I've been telling them for years that we were going to have a pandemic. The climate was right for it. International travel and business in a time of political discord, at a time of people having less trust in healthcare and in politics, and so many things happening at the same time. My guess is because of all of that, we will probably have another one in our lifetimes. I don't think it's going to be another 100 years because of just how pandemics happen. Like COVID isn't the first pandemic level virus we've had in the last couple decades. Some of you'll remember swine flu, H1N1, bird flu, chikungunya, Ebola, Zika. Like we've had a ton of stuff pop up over the last little bit, but the climate was different. And so those were handled a little better. And as people have more opportunities to learn about different things, we still have to have a deference to expertise. And so we still have to consult our physicians and our experts and make sure that we're able to take that information as it applies to us specifically. Some of the traumas historically, like Tuskegee and experimentation during slavery, things like Henrietta Lacks and all the things that have happened to Black people over time, we have to never forget that stuff. But we also have to define what success looks like as far as when we move out of civil rights and those kind of things. And with Tuskegee specifically, people were denied the opportunity to have penicillin, which would have cured a lot of those men who got syphilis. I've even heard some of my family talk about how, men were given syphilis during Tuskegee, and that's not true. They were only denied the treatment. And now fast forward to COVID, and we had an opportunity to get vaccinated with everyone else. This is what that generation prayed for. It was, our government is probably never going to come out and say, hey, I'm sorry. But the opportunity to say, hey, we recognize that COVID is, 3 times more likely to kill a Black person. And so we want to make sure that your community gets vaccinated and has an opportunity to get vaccinated was what we wanted. And the trauma of always having to wait until white people or rich people or whoever got it first, now we're doing it on our own without even thinking about it. And that is what trauma looks like. And so I think we have to understand where this fits in historically. And when we look back, you know, a lot of people are going to be on the wrong side of that. I had a patient actually a couple weeks ago who told me like, hey, I read this, I read that, and I just don't think this is safe for me. And I explained why it was safe. And at the end, we agreed to disagree. And I asked her, I said, one of us has to be wrong. Are you willing to bet your life that I'm the one that's wrong? And the next day she got vaccinated. And I think we have to, you know, have those hard conversations, but we have to have those conversations with people that we trust. And I would say to anybody who still has concerns or who's read things, talk to your doctor. And if you don't have a doctor that you trust to have this conversation with, find you a new doctor. Because we have to have advocates in our community who are going to speak up for us, who are going to tell us the truth, and who are going to honestly keep it real. And all of that's important, especially in Eastern North Carolina, where we are much more likely to die of not only COVID, but strokes and heart attacks and everything else. So those are my thoughts.
Thank you so much for that. I think in the chat, we do have a couple of things about the vaccine hesitant family members, and is there a way to get this message to them? Absolutely. This is being recorded and for that exact purpose. And so once this is over, it will be posted on the Chi Omega Facebook page, and we can send a link out through the email that you registered to, so that you can certainly get this, and please, please, please share it with your family and friends. There is another question in here about the likelihood of having to receive a booster. Would anyone like to cover that?
So I'll take that. We don't know yet. There have been reports that we will likely, but that's being studied right now. So the jury's out still yet. What we're focusing on is getting everybody vaccinated, and those studies are continuing so that we have the information that will tell us if we need to have a booster and when would we need to have that.
And I'll also add that the variants and different things that will cause us to need a booster happen because people continue to get the virus. The virus changes when it gets opportunities and new people. And so this vaccine is a group project, and the people who were probably the ones to get their work done early in school have already gotten their vaccine. And now the ones who aren't are messing it up for everybody. And we're all gonna get the same zero at the end. And that is gonna make all of us have to get boosters and get vaccinated. And so that's why it's so important to get on the people who aren't getting it, because we have to all work together on this, or we're going to continue to have the same issues.
I love it. I love the way you put that.
Yeah.
There was another question that someone asked: had everyone presenting gotten their vaccine, and what was your experience when and if you've gotten it? And I'll start that I did receive my vaccine back in February. You know, my experience after both of my shots was, you know, I did have, you know, a really bad headache for maybe a day, some fatigue, but it went away in a day's time, and the next day I was back up and at it. Everyone else would like to share?
I've been vaccinated as well. My mom and I both got vaccinated as soon as we could. First shot I did fine with. Second shot, a little headache, a little fever, lasted about a day. From talking to people at the hospital and patients, people that have had COVID, when they get their second shot, tend to have a bigger immune response. So they do tend to feel a little bit worse than people who haven't had COVID. But that's just from talking to people who've been vaccinated and who've had COVID and not had COVID.
I've been vaccinated as well. And my rationale was I fear the virus more than I feared the vaccine. And I had some anxiety. I talked to people, and I will share, and actually my twin sisters was on the call earlier. Our mother contracted COVID, unfortunately, and was hospitalized for an extended period of time. And we're so grateful that that she survived. But we, my mom lives with my sister, I help and travel there, and the thought that we might, be of some harm to her, or that I wouldn't be able to see her because we couldn't obviously see her while she was hospitalized. So talking to other people, getting that information, but really fearing that I would get sick because of risk factors led me. And that's where we really need to understand that the side effects that I have are very mild, and it varies. But I knew what the likelihood would be if I got COVID.
Yeah, and I've been vaccinated as well. My wife and I got the J&J vaccine, actually. And my mother got the Moderna. And to Tedra's point, I have an 88-year-old mother. She lives with us. I didn't want to run that risk. My daughter's at UNC Gillen School of Public Health. She got vaccinated with Pfizer. We didn't want to take that chance. And, I challenge people. They always ask me about my mama. How's your mama? How's your mama? And I'm now beginning to say, have you been vaccinated? Because obviously you care about it. If you care about it, get vaccinated. And so I had about 12 hours. It was kind of rough, some little fever, chills. Wasn't smart. I did it on a Saturday and I had to preach on Sunday. But at 6 o'clock in the morning, I felt great. And I think this also, Sherry, speaks to the fear issue. People I think that I talk to are fearful of how their body will react to the vaccine, or they're fearful of the long-term implications of the vaccine. And what I say to people who are fearful, well, how will this vaccine affect me in 10 years? I tell them nothing is as permanent as death. And so the reality of it is whatever you're going to experience is nothing compared to not taking the vaccine. And then I thought about the 12 bad hours I had. Imagine feeling that way for 6 months because I had COVID. Imagine feeling that way and being on a ventilator. 21 years of pastoring, I've had to deal with more ventilators in 6 months than I've had in 21 years. And so I would encourage people to get vaccinated.
Yeah, I got vaccinated early. I wanted to be first. I wanted to have the picture in the paper. I wanted to be able to tell my grandkids that we finally did it and got to the point where a 30-something-year-old Black dude could be the first one in line. I also wanted to get back to normal. I'm an internal medicine doc. I have a practice, primary care practice, but as a hospitalist, I'm the one in the ICU putting those people on ventilators. And I have lost more patients in just December and January than I lost in my entire career combined. I've seen death that people aren't designed to have to deal with. I've had to call spouses to tell them that their loved one wasn't going to survive when that spouse knew they were the one who brought it home and gave it to them. I've watched so many people die alone because we couldn't have visitors in the hospital. I've had to be the one holding someone's hand, knowing that this person could get me sick just so they didn't die in that room by themselves. And the things that COVID has caused, the trauma, the sleepless nights, I am not an emotional person. I have cried more in the last year than I have in my whole life. This has been so hard. And to have an opportunity to say, I'm gonna do something to help this be over with, was something that I jumped for. And so I got Pfizer because Moderna wasn't even out yet when I got my vaccine. And the same as everyone else, the day after the second dose, I felt terrible for about 8 hours, and I went to work and I held people's hands in the ICU just like I do every other day. It didn't keep me from doing anything, and by the next day I felt fine. What I have noticed in my patients is that how you feel the next day is pretty age dependent. The younger you are, the more significant your symptoms are going to be. If you're over 65, you're going to be fine. Your immune system's not really robust enough for you to have a pretty big reaction to that. If you are 20, 30, 40, take the day off after your second dose. If you have already had COVID, the response that most of us had to the second dose, you will probably have to the first one because you've already had COVID. And so just be prepared for those kind of things. But other than that, everybody's done fine with it.
Thank you so much. And so I think we had one more question in the chat, and then we will move to final remarks. And that question was, what about the multi-system inflammatory syndrome linked to COVID-19 in children? Wouldn't that risk warrant vaccination for our youth?
That is a great question. Unfortunately, we do not have a pediatrician on this panel. I don't know if Dr. Payton wants to speak to that, but I will say that what we do know about that is that it is incredibly rare. And I think it also speaks to the fact that these vaccines are under so much scrutiny that even with something like that, we wouldn't just jump out and say, hey, you need to get vaccinated to prevent this issue. They're going to go through the same scrutiny that they always would if they didn't cause any problems. But yeah, Dr. Payton, I don't know if you have any.
Yeah, it is pretty rare. One of my patients had a child at 5 months who got it, recovered, but still recovering. What I'll say is the best way to protect your children is to get everybody vaccinated. That's why I'm trying to encourage all my pregnant patients to get vaccinated, or if you don't want to get vaccinated while you're pregnant, breastfeed and get vaccinated. So that way you can pass on some immunity to the little ones who don't have it. But the best way to help our children is to vaccinate ourselves.
Thank you so much. So we will now move to just kind of panel final closing comments. We'll start with you, Dr. Casey.
I'm sorry, who'd you say you started?
I will start with Dr. Tedra.
Oh, okay. I'm sorry. I thought you said Dr. B. So, yeah, there's so many things I could say, but awesome panel. I do want to highlight something that Dr. Bonner and everyone has mentioned about the levels of trauma and grief that we are seeing, both from death, but just illness and the loss of connectedness. So it's really important for us to be intentional about staying connected. And there are a couple of resources I want to point folks to that some have been put in the chat. But in North Carolina, we do have a hotline that was started, Hope for NC, at 855-587-3463. And there's actually a line for those of us who are in healthcare, Hope for Healers, the Suicide Prevention Lifeline at 1-800-273-TALK, which is 8255. There's also a distress hotline that you can text home to 741-741. Therapy for Black girls and therapy for Black men offer culturally competent care as well. So I just want folks to know that you're not alone, that help is available. It's natural to feel some distress, but it's not okay not to get help. And you have a wealth of resources, as you see today in your communities, from our faith-based leaders, our legislators, your healthcare providers, your sisters in Christ, who are also here, who can be that support and help us as a community to move forward with taking care of ourselves through vaccination and continuing the public health strategies following the 3 Ws. Thank you.
Thank you. Dr. Bonner.
I just want to say thank you to everyone for the time, for listening, for the opportunity to speak and give this information. I'm hopeful that someone got something out of it, but my ask is to tell someone, if this stops with just the 50-some people on this call, then this wasn't the goal. So please encourage your coworkers, your family members, your friends, share as much as you can. Like I said, this is a group project and we all have to work together for our community. And right now it just seems like we're making so much progress with social justice and so many different things. And COVID is a part of the ask to just say, hey, we have to get vaccinated, we have to move on, we have to continue to create a better future.
Thank you so much. Pastor Gailliard.
Thank you, Sherry, and thank you to the panelists. I have really enjoyed everyone. I've learned a lot. I guess my final statement would be, if you're watching this or this gets shared with you and you live like in Spring Lake or Roanoke Rapids or Tarboro, Wendell, then more people have already died of COVID to wipe out your whole community. more people have already died. So just imagine everybody who lives in your community dead. This is not the flu. More people have died in our area in 1 year than in the flu in multiple counties over 10 years. And so this is real, but it is beatable and it's winnable if we would just have a willingness to operate with a consideration for ourselves and for one another. And so, to use the words of scripture, I would implore you, I would beseech you by the mercies of God to present your body a living sacrifice so I don't have to say earth to earth, ashes to ashes, and dust to dust over you.
Thank you. Dr. Payton.
Well, I'm not as eloquent as a lot of the other speakers, but what I will say is this: people I see in our hospital, majority that have COVID look like us. The ones that die COVID look like us. So think about it, get vaccinated. If you have questions, you guys have my email. Please feel free to email me. If we didn't answer your question today, come see me if you want to. But it's up to us to help ourselves and help each other, because nobody else is going to help us. So help yourself.
Thank you so much. I would like to take this opportunity to thank the panelists so much for their time and expertise and their commitment to the health and well-being of the citizens of North Carolina. Secondly, I would like to thank the Mid-Atlantic Regional Director of Alpha Kappa Alpha Sorority Incorporated, Ms. Jennifer King Congleton, for the partnership and sponsoring this effort. We look forward to future endeavors. And thank you to everyone that attended today. And I truly, truly hope that your questions have been answered and that you can now move forward with a fully informed decision about receiving the vaccine. Now I'll turn it over to President Williams for closing remarks.
Thank you, Mrs. Bryant. Again, thank you to each of you that have joined us. Thank you to the members of the Alpha Kappa Alpha Sorority Incorporated Directorate who are on the call. And last but not least, thank you to Ms. Jennifer King Congleton in her absence for our Mid-Atlantic Regional Director for this partnership. It is our hope that you have gained some valuable information today. Again, thank you to all the panelists for the valuable information. Thank you all and have a wonderful afternoon.